Give me just a second, it's preparing. Thinking, done. Okay. Give me just a second, it's preparing. Okay, there you are. Okay, we are now live.
Great, thank you. All right, welcome everyone. It's been a while since we've been together as FBAC. And we have a very small group now. We've dwindled in size. So I'm filling in as the president since we've lost both our chair and our co-chair. And so I'll kind of lead us through the meeting here, and then we do have some applications to look at the end. So we'll review those. But I will officially call this meeting to order. And are there any other items that need to be added to the agenda?
No, not from me.
All right. Moving on, I have to keep pulling up the agenda here. Is there any public comment? Didn't think there would be. I'm going to quickly go through my director's report, and I have asked some of the supervisors to be on here and some of our leadership team to give any other updates. But I'll start with my screen. Okay. So I guess I have to push share. Okay. Can you all see that? Okay. And just to make sure, can you all hear me okay?
We can, Julie.
Okay.
It's a little echoey.
Is it? Let me know if it gets real bad. Right now there's a fan going on. I'm in the kitchen at Potter Hall at our vaccination event, and there's a fan going on right now. So I can't hear you all real well, but as long as you can hear me, that's good. So I'm gonna start my update, and this is the same update that I give the commissioners. I did this 2 weeks ago. I started with numbers, COVID numbers. I always start my updates with COVID. 1 second. Can you all still hear me okay?
Yes. Hopefully we'll get her back soon. We can just wait.
Okay, sorry about that. Can you hear me? Okay. Check out that. Oh. Shanika, could you make me host again so I can share my screen? Thank you. Okay. So sorry about that. Continue where I left off. So good news is our percent positive has been declining. In our new report today, we saw that it's below 2% now, which is great. We've been right around that 2% for the last 3 weeks, and it finally dipped below that. We only had 6 new positives from our report from when we reported on Monday, so that's good. We have been under 5% now for 2 months. So very good news there. We only have 1 person in the hospital today, nobody in the ICU. And those are some of the criteria that we look at when looking at things like restrictions in our orders. We look at our percent positive, we look at the hospitalizations, if the healthcare system is being overwhelmed. We also want to look at our region, what's going on in our region, and make sure that the same thing's happening there and make sure there's no concerns there. So those are some of the things that we look at. We'll continue to monitor for variants. We had a little scare, what was it, a couple months ago, but nothing came of that, luckily. So we'll still continue to monitor for that. As far as testing update, really there's no excuse anymore in the community to not get tested. There's plenty of opportunities to get tested. We're still doing testing at most doctor's offices, K-Stat. We do symptomatic testing under our tent at the health department. Well Health is the company that is contracted with KDHE. They will continue with us through May 21st. Their contract has been extended. They offer free saliva-based testing Monday through Saturday, 9 to 5:30. So they'll still be available. They are now located at what was formerly known as our alternate care site. That's at 419 Holiday Drive. And we do encourage people to schedule an appointment to be able to do that. So you can visit their website, gogettested.com, and easily schedule an appointment, even same-day appointments. But they will still take just drive-ups, even if they don't have an appointment. And it's usually about a 1 to 2 day turnaround for the test results. We have our RedX program at the health department. They're very active out in the county, going to various locations in the county at least twice a week. They were actually just at the mall earlier today from 10 till noon, giving out the free saliva-based test. We're looking at including vaccinations with them in April, so sending a nurse along to do some mobile vaccinations with them. As far as our vaccine information, we are finishing up. We have finished most of our phase 2. We're still working on some of our critical workers. That's a long list of individuals who are considered critical workers. So retail and in the food industry. So we're still working on getting some of them finished. And we have started phase 3 and phase 4 this week. So the way we explain it is we're finishing up our phase 2, but we've sprinkled in some of those phase 3 and phase 4 individuals as well. Today, we had a clinic in the morning. It was for first dose. In the afternoon, we did our boosters. Tomorrow will be all boosters. So we've hosted 3 clinics, or we will have hosted 3 clinics by the end of this week. Again, on free testing, this is just to reiterate the fact that there's plenty of testing and lots of free testing available. I mentioned Well Health. I also mentioned that we do symptomatic testing at the health department. We still have that screening line available that we've had this entire pandemic. We have reduced our hours to Monday through Friday, 8 a.m. until noon, just due to reduced call volume. We do the nasal swab, and it's an instant turnaround, but that is for symptomatic individuals only. Outside of Manhattan, our RADX team is very active. As I mentioned, they go to different places like Randolph and Leonardville and Ogden. They've been to the mall, east side of town in Northview. They do have those saliva kits available for asymptomatic or symptomatic individuals with a very quick turnaround. They can administer them for you, which they end up doing when they're out and about, or you can take those home with you, and there's instructions on how to administer those tests and mail it in and get that quick turnaround for results. Now to more some of the traditional health department information that I give. I always report on what grants are coming up or what we've submitted, and we have submitted our big Aid to Local package. As you can see, it funds a lot of our programs. I have on there now open, but that's not true. That was back when I gave this presentation to the Board of Health. That was a March 15th deadline, so those have been turned in. So that includes our immunization action plan in our clinic, as well as family planning in our clinic, maternal and child health program. That includes emergency preparedness program, as well as our regional emergency preparedness. The family planning, state formula, our CDRR, chronic disease risk reduction, and our child care licensing. So as you can see, it's a big package. So it's very important that we get that in on time. So we did submit that on March 15th, and we probably won't hear for another couple of months, but that will start with the fiscal year July 1. As far as staff updates, we did hire a new child care licensing surveyor. It was a quick turnaround. We had a staff member leave us for a better opportunity. And so we hired Julia Minich. She started as an intern and then moved into our one of our COVID contact tracers position. She did a lot. She wore a lot of different hats when she was in that position. And now I'm happy to say that she moved into a permanent position as a child care licensing surveyor. So she will start next week in that position. We also have one position that's open. That's our chronic disease risk reduction coordinator. That was Shanika's job. Shanika has moved into the health educator position. That health educator position is full-time. That was Ed Callis's position. So we're happy that she has moved into that position. But Shanika has really taken on a lot of responsibilities. So she's now doing health educator position. She's still wrapping up the CDRR position since it's open, and she's taking on COVID responsibilities. So she wears a lot of different hats, and I'm sure she's tired. So we want to get that position filled. It is a part-time position, but with benefits. So if you wouldn't mind spreading the word, we only have one individual that we are looking at interviewing next week, but it has been open for a little while and we just haven't had many applicants. So if you wouldn't mind spreading the word, that's available on our website. And if they have any questions, they can always reach out to myself or even Shanika. We'll be happy to answer questions about that position. So now I'm going to turn it over to my supervisors that are on anyway, and we can kind of go down the list here and you can give any updates from your department. So we'll start with WIC. Kaylin, if you want to give an update.
Yeah, so WIC is still completing appointments by phone. We are looking to start having our new participants start doing their first appointments in the office in June, and then still trying to leave the rest of the appointments remotely to avoid extra kids in the office. March is National Nutrition Month, and so we have used some grant funding that we had received last year to do a social media campaign and highlight some of the nutrition services that WIC provides, and give prices to some WIC participants. We're still encouraging anybody who wants to see if they are eligible to fill out the online application or call either office. We have staff in Manhattan and Fort Riley full-time. So that's all I got.
All right, thank you, Kaylin. I'm sorry, I don't know if I cut out or not. Breva, if you're there, do you have an update for your program? She just texted me, her mic won't work. So we'll come back to that. And I think Erin is out here. I don't see her on here. I think she's out here at the clinic. So I'll gladly give her update. It's basically COVID vaccinations. That's pretty easy. Most of the nurses are either here or they're back doing some reconciliation with the forms. We are starting to get more into our regular immunizations. On Mondays when we don't have clinics, we are getting back to our regular immunizations as that's something that we definitely need to get back to. And we've been doing family planning appointments this whole time. Terry Stewart is our APRN and she sees those patients daily. So we've continued with that pretty much this whole time that we've been doing COVID vaccinations. Eventually, we are hoping to move this operation to the health department when we get more, through the phases 1 through 4, we can start to see more individuals just coming through the health department once we start to kind of die down out here. And then we can also get back to some of our regular appointments at the health department. But I think that would be her main update. And Heather, are you on for childcare licensing? I think she might be off today. I think she was. Yes. From childcare licensing, basically it's business as usual now. They're back to their regular visits. They're starting to do their own fingerprinting in-house. It used to be where the providers, childcare providers, had to go out and get their fingerprinting done, and it was a pretty steep cost. So now childcare licensing, Heather has gotten approved and trained to be able to do fingerprinting there in-house. So that was kind of exciting to be able to offer that to our childcare providers. Other than that, they're just answering a lot of questions about isolation and quarantine and vaccines from the childcare providers. We have gotten most of our providers through. We've been offering it now to providers, the vaccine, for the last 3 weeks. So I'm happy to say that we've gotten most of them that have wanted the vaccine to come through and get that. And then I believe Jan is away today, so I don't think she's on from Raising Riley. But again, with Raising Riley, it's been pretty much business as usual. I know a lot of them are out here right now helping with the vaccine clinic, but they continue to do some Zoom classes and some other regular duties as well. I know they just went through a curriculum change, and so they all got certified in the new curriculum now to be able to do those classes and visits. So, that's all I have right now. Are there any questions for me? And you may have to write them in the chat because I'm not hearing things too well out here. Good question. What is the plan for the mask mandate?
I'll ask my question as well out loud for Julie. I was going to ask, you did mention it though about other vaccines. So do you think that the clinic staff thinks that immunization schedules are on target, or do you think that we might have some catch up to make, or where do you think we are?
Yeah, I think there's definitely probably some catch up. I'm just not sure right off the top of my head how much that is right now. That would be a good question for Erin. But yeah, the sooner we get back to that, to our regular schedule, the better. We definitely need to get there. So. And then I was going to answer the question, what is the plan for the mask mandate? We are discussing that. In the public, for the public tomorrow. So if anyone wants to, you can either view it via YouTube or you can even be there in person if you'd like to. I believe it's at 10:40 or 10:50 tomorrow at the VOCC meeting. We have a draft of order number 21, which would basically extend the county mask mandate like the city has done. So we are mimicking or planning to mimic what the city has in place through, I think, May 16th is the date. Right now, our order 20 is up on April 1st. So if we can extend that, I think that would be for the best. But we are discussing that with the commissioners tomorrow at 10:15. Anything else? If not, I'd like to get to the applications. And did you all have a chance to view those ahead of time? Review them. Is there any discussion on those?
Julie, I just wanted to remind, so we have 3 members on our committee today because we've had obviously people move off. So I'm not sure if Jennifer or Kate were here the last time we went through new applications. And so I just wanted to make sure that both of them understood the process. And I was a new member when we renewed other people's applications. So I just want to make sure that we're all clear on the process, that we see the applications, but it's the board that actually approves them. Am I correct in understanding that?
Correct. Yes, we see them first, and we can move to send them on to the board or give approval, I guess, to send them on. But yeah, it'll be the Board of Health that actually does the final approval. So yeah, good point, Ellen. I forget that we have new members on. So I think our main job is to, if there is any discussion, if there's any concerns, we can discuss that. But if not, we can move to go ahead and push these up to the Board of Health so that they can make that final decision.
I thought it was really difficult to actually get a feel for what the applicants would bring to the table. They didn't, neither of them actually wrote very much in support of how they would strengthen our team. And so that doesn't mean that they're not okay candidates. It's just, it's really hard from their very, very minimal answers on that form for me to be able to support or to not support them.
Yeah, good point. That's true.
Yeah, I agree with Kate. It wasn't a lot of information to make a decision on, particularly if people on the committee right now are not, aware of who the applicants are, which I am not really. So I don't have background or knowledge other than the 1 or 2 sentences that was written on the form. So perhaps that could be something that we would like to ask in future to give more information.
Yeah, absolutely. I think it'd be worth looking at that form and adding some more questions so that they would have to answer a little more openly on that. We could bring that to the table next time and revise that form. It's probably been a while since it's been there.
Are we able to go back to them and ask them some of these questions like that we're mentioning? I mean, are we able to go back and just ask them before we submit them?
I'm sorry, I didn't hear the question.
Oh, yeah, I'll type it for you, Julie.
And Kate, to answer your question, I just saw in the chat, yes, I think that'd be very helpful to share support of extending the mask mandate. Yeah. And Renee's question, are we able to go back and ask them some of the questions that have been brought up? I'm not really sure on this. I would have to, I'll have to discuss with Cindy Gabriel maybe and see if that's something that has ever been done or if we could do it. I don't see an issue, but I'll ask her a suggestion. And that reminds me, I didn't ask Renee or Shanika if you had any updates. You guys want to jump in? I'm sorry.
That's okay. I think you've mostly covered everything that we're doing right now. Obviously, my team is really focused on the COVID response. So we're, like you've said, we're going through monitoring all the cases. We are switching over to the state system next week. We're training with them and then switching fully to the state's reporting system for all of our COVID cases. We are currently doing what's called a reconciliation of all of our cases, going through to make sure that we don't have any college students that we followed that were maybe followed by their home county. So we are currently in the middle of a reconciliation, making sure that those cases weren't counted twice in the state. So it's we started about a week and a half, 2 weeks ago. We're going through every single case that we have. So we are at almost 6,300 and we're going through every single one individually, pulling up every single file, making sure that they weren't covered or followed by another county. If we find that a college student was followed by both Riley County and another county as like their home of record, then their home of record may supersede us following them. So we may have some adjustments to our numbers at the end of all of this, but we never had the chance to do it because we've been so heavily busy with the amount of cases we've been receiving. I know back in December, we had, 100 cases a day sometimes, 400 or 500 cases a week. Now that we're down a little bit, we have really worked hard. So if you see people walking, because I know y'all seen people in and out, people are constantly checking files, pulling files, going through records, just verifying. So that's pretty much what's taking a lot of our work, in addition to my team's answering the vaccine line, helping answer any questions, getting people registered, helping coordinate the homebound vaccine schedules with Aaron with the clinic and Alex Protzman with Raleigh County EMS. They've really done a great job with the homebound vaccinations. So we're kind of just helping fill in where we can just to make sure that we're doing everything, and the COVID screening line. So with Julia leaving and moving over to childcare licensing, we've been trying to make sure we're getting everything transitioned to other individuals before she leaves. So that's kind of the update that I have for right now.
Okay, thank you, Renee. Shanika, did you have anything?
I did not. I think you all covered everything with just the hotlines and everything. Outside of, we still are answering our Riley County COVID hotline email. There is also a vaccine email, which is vaccine@rileycountyks.gov. A lot of the emails that come to the Riley County COVID email is vaccine in nature. So we are answering both. So just a reminder that if it is vaccine questions, it can go to the vaccine@rileycountyks.gov email.
Okay, thank you. So I will follow up with Cindy on that question of Renee's to see if we can ask some more questions. If not, is it fair to say that we can go ahead and move them on to the Board of Health, and then next meeting we can go ahead and look at revising that application? See some nods. Good. Okay. I need to look back at my agenda real quick and see, is there any other business that we need to discuss?
I have a maybe slightly random question. I know that the organizers of Everybody Counts are meeting next week to discuss plausibility for this summer for doing Everybody Counts. And I just wondered what your thoughts were collectively from the health department.
Yes, I think I heard the question, and we do have a representative. Shanika is actually going to be attending that meeting. Is that what you asked, Kate? Okay.
My question is, do you guys think that it's a good idea for us to pursue Everybody Counts this year, or do you think we should be holding off another year?
Go ahead, Renee.
So I actually just got off the local health department update with the state, and one of the things they're saying is, as we're starting to transition back to normal events and normal scheduled agenda items, that one thing that they encourage, if they're willing to do it, the state will provide free test kits called Bionex Now. It's an Abbott Bionex Now rapid test kit. It takes about 15 minutes to get the results back, but they're trying to encourage like schools, if they're going to hold proms, they want schools to look into do it. They'll provide the kits, they'll provide everything, all the training and stuff to do this, so that way you can still rapid test before individuals as they come to it. So that way, if they test positive, they're not allowed in. But if they are negative, then they say, you know, it's obviously, then you've at least done that part of it. So you can consider it to be a pretty safe event. Still following, you know, the mask, wearing masks and doing what you can to social distance as much as possible. But so if, and I need to kind of get with Alice, our public information officer, to put a little bit more information out there to the public, just on what this program entails, how they can get signed up, and what we can do to kind of help coordinate some of this. And they're recommending this for any big event. So like if schools are wanting to hold graduations or senior class school camps during the summertime, so like a band camp or you know, camps in general for the summer, all the summer camps and stuff, they recommend that this is something that they consider. And at the same time, the state's also willing to give them a $30 stipend for every test that they do perform. So it may have a financial benefit for some of these organizations that are always looking for an extra way to have some little bit of income coming in, is if they do perform the test and they, you know, follow the state's guidelines of how they want it done, they'll get $30 for each test administered. And they're actually pretty simple. I've used them before. So I think that's definitely something that we need to get more information on so that we can share that out for everybody. But it's just one way to start getting us all back to a normal flow of, you know, what life was pre-COVID. Does anybody have any questions about that at all?
Thank you for that information. I think that's great.
There you go.
And Julie had to jump off.
Okay, we can finish up. I was just going to tell Renee, thank you. That was really good information about the rapid testing for larger groups. That I think will be very helpful and will make people feel better about attending a large event that maybe might not go otherwise.
Yeah, I just got notification from the state yesterday. One of the church councils or something has a big convention or something this summer or maybe later this spring. And I'm assuming it must be in my county because they forwarded the information to me just to give me a heads up. And they're going to do the same thing. They're going to rapid test everybody before they go. And then if it's over a consecutive day event, then they'll rapid test every day and the state will provide them the kits. And like I said, if they have 400 people in attendance and they're rapid testing every day, that could be a pretty significant supplemental income for them at the same time. And it doesn't take a lot if they have some volunteers who are willing to manage it. I mean, if you've been out to what we were doing at Seco Park, you can make it a very fluid process to where it doesn't take a lot of time at all. So,
Yeah, exactly. And may also catch some asymptomatic people, which is always a positive, literally.
yeah. And that's one other thing, you know, if we catch somebody, yeah, they may be asymptomatic, but if we catch somebody who does test positive on those Bionex now, we can always send home a saliva-based test kit, which is a PCR-driven test kit that at the same time, they could also send that off just to make sure, you know, to try to get that confirmation. But at the same time, as long as people understand, like the saliva-based test kits do have a little bit of a lower sensitivity. So that rapid may pick it up before the saliva test kit does. However, if obviously the nasal pharyngeal is the gold standard of testing, but the Abbott ID now is the molecular base, so the NIAT, and it is considered to be a PCR-based test essentially as well. So. Sorry, didn't mean to get too wordy in there, but it's nice to make sure people understand the wording and everything behind everything.
For sure. I was just going to, I don't have any more questions, but I was just going to thank Shanika now that you've taken over Ed Kalis's role. The health department helped a lot of graduate students last summer and over this academic year finish up their public health projects. So thank you to everybody who helped them. And Shamika will be sending you lots more students, but maybe when you're not so busy. But thank you in advance for working with them. I know you've already started a little bit of that.
You're
We-
welcome.
I will say we've had some great interns so far. I have one that's actually finishing up tomorrow. I was trying to get her to come on camera for a second, but tomorrow is her very last day. Oh, she may have already left, but I have had such great interns with the schools, and we have, a couple more starting. So I've already been thinking of projects for them to get going. I know Emily, I think it may be our next one starting up, and this is one of that community partnership that I was just talking about with the organizations. I figured that was a great program for her to kind of oversee and head up for me. So, but yeah, keep sending them our way.
I don't have any more questions or
Okay.
comments other than the 2 new applications. We will still need to solicit for some new members. So if anybody listening, or if anybody has a colleague that would like to join, that would be really great.
Okay, well, I guess if there's no more questions or comments, we can go ahead and I will end the live and we'll end the Zoom meeting. Okay, thank you all for being here, and we'll see you next time.
Thank you. Have a good one.
You too.